Hi there, Dr. Davin Lin, board certified laser dermatologist. Today we'll be talking about skin rejuvenation and how I balance skin texture, tone and volume to achieve this result. This lovely lady came to see me. She's looking somewhat tired and would like a freshen up. How did I do this in a period of 6 weeks? So here's my little story of how it's done. Now, for facial harmony, it's really important that we balance skin texture, tone and volume. I'll say that all the time, texture, tone, volume. If you get that in harmony or in balance, you get a really, really good result. So texture is basically the palette of the skin, tone is how tight it is, and volume is, I guess, self-explanatory. Over time, we lose volume, both with bone resorption, but also fat and also collagen. And the way to replenish that is with fillers. So this video is a kind of a cool video because you can see how I replenish volume but also improve texture and tone. There was one stipulation with regards to this patient, was that I was not allowed to give her any downtime. In other words, anything I performed had to have no downtime. So you can see how I performed the filling procedures, but also my favorite laser which I use, which gave 0 downtime. So thanks for watching this video. Step 1 is replacement of volume, and this is how I do it. What we're going to do is I'm going to show you a cannula technique. It's very important we use different techniques in different areas. So the first one I'm going to do is what's known as an entry point. So I'm using a needle. It's going to sting a little bit, yeah? Okay, just relax there. So I'm just using a little needle. I'm just getting an entry point here. Here we go. Did that hurt?
A little bit.
Just a tiny bit.
Just a tiny bit.
So I'll just twist this a little. Just let it sit there just for one. And this is what's known as, this guys is what's known as a cannula. So a cannula looks like a really nasty sharp needle, but it's not. It's actually a blunt instrument. So you can see that, how flexible it is. Okay, the reason why we're using a cannula is that I can push structures such as nerves and most importantly blood vessels out of the way. At the same time I use this as a filler. So sometimes I use this to subside if there's scarring, but it's a nice way to actually deliver using just one entry method. And you can see where I can get with this. So basically I can target different areas all the way from underneath her eyes, swivel that to give her some cheekbones, and all the way back there as well, just using one entry point. Okay, and I'll show you how it's done shortly. The needle comes out, and don't worry, that's fine. This goes in. This part's a little bit hard sometimes because you do have some scarring here from your condition. And there we go. We're in there, you right? Okay, just relax there. So going back up a bit. Sorry, there's a little sting here. So guys, I'm using a product called Juvederm Lift. As the name suggests, it helps to lift. It's a little bit thicker than the Bella. Her skin type is because she's got very thin skin. Ordinarily I'll be using a product like Juvederm Voluma. So once again, it's a very slow technique. Just putting tiny lines of filler. I'll mold it at a later stage. And with this you can see I can actually go, give her some cheekbones over here as well. So I've got my finger up on there as a safety, so I know where the tip of the cannula is. And we can go medially, so I can go even in this direction, using the same entry point. Well, they did this out later. This product is very malleable, so you can see I can actually mold it. Any lumps and bumps will give it a nice massage. Does it hurt when I massage?
No.
No. So we've got that pull back over here. You can see, just look at the jawline over here. You can see that pull back over there. And yes, she does have a little bit of irregularities there, but I'll massage that out over the next couple of minutes. Okay, so that is a cannula technique using HA-based filler. So you can see that only took me a couple of minutes to do. That's 1 ml of filler, but it's a very safe technique. And like I said, you can have multiple injections. You have one injection point, but you can aim it in multiple areas. That reduces the chance of bleeding and bruising, and in my opinion, it's a safer technique compared to a needle technique in certain areas. Do I use needles? Yes, I do, but only in certain areas. Okay guys, so you can see that's the after of just 1 ml of filler, and the results will continue to be improved over the next few days. So thanks for watching guys. Step 2 is designed to improve skin texture with no downtime. Now, this is a Picosure laser. I've never seen a laser decorated like this before. I mean, seriously, look at the work of art. This is actually Aboriginal style art, which is basically our native type art form. You can see these little dots around here, and the laser's decorated. It is an amazing, to me, apart from the laser itself, it's an amazing piece of artwork. And I'll show you the results which this laser can deliver. So watch this video. So this is the Picosure laser in its working environment. It uses what's known as Q-switch technology or picosecond technology, and it delivers what's known as laser-induced optical bodies. So the patients who benefit best from this will have a little bit of melanin, in other words, for a slightly darker skin type. So the laser produces LIOBs, which in turn stimulate collagen, and that's why you get an improvement of skin texture. The brilliant thing about this laser is that it has virtually zero downtime. At the most, the skin is red for about 8 hours, but makeup can be worn the next day. So it really is an impressive laser, but it's suited mainly for darker skin types. So let's look at the before and afters. Look at her skin texture and her skin tone and volume there. Look how dry her skin is. And look what fillers can achieve together with laser resurfacing. There she is after 6 weeks. Her cheeks are much fuller. Yes, I do believe there's slight overcorrection in her cheeks, but this will settle down. But you can see there's a marked improvement in a lot of aspects of her skin. Her eye bags have also been improved. Note, I didn't even use any filler around that area. This was all due to the laser itself. Hey guys, thanks very much for watching that video. So you can see the importance of balancing texture, tone and volume to give you the best possible results whilst looking natural. I don't believe in laser resurfacing everyone. I believe in facial harmony, and for that I do believe that using the skill sets of lasering, filling, Botox and a lot of other procedures, sometimes even surgical, to achieve the end results. And this way everything looks natural. So I hope you enjoyed that video. And yeah, subscribe if you like more videos. I post one video every Saturday morning, Brisbane time. Once again, thanks for watching. Bye. So this channel is about dermatology, aesthetic dermatology and laser dermatology. I post one new video every Saturday, and the videos I guess vary from time to time in regards to everything from acne scar revision all the way to facial rejuvenation. I'm also on Instagram, so I do post quite a fair few 1-minute clips every week, and lots of pics. So if you're bored, follow me on Instagram, and hope to see you soon. Bye.